Okay, we'll go ahead and get started. I'd like to welcome you this morning to the Human Development Subcommittee, and today is March the 6th. Hard to believe. And we have some other senators that have told me they may be late and some that may have to leave early. But one thing is for sure, we have to be out of this room at 1 o'clock. So we will be out of this room. With that, if some of the people standing on the wall, if you want to sit at the desk, feel free. Just leave these first desks out here open and have a seat. First off, senators, I believe you have your reports in front of you. And today we're going to be talking about fiscal year 13 and with the governor's recommendation. If the presenters want to only address the governor's recommendation, do not get us confused. If you shift over and start talking about the House's recommendations from yesterday, I need you to differentiate that so we know exactly what you're talking about. But our focus is on the governor's recommendations. So with that, we're going to go in the order of Office of Children and Families, Department of Veteran Services, Department of Behavioral Health, and then the Department of Human Services. And last, we'll have the Georgia Council on Aging. So that with that, let's start off with the Governor's Office of Children and Families. Katie Jo? We're delighted to have you here today.
Thank you, Madam Chairman and committee members. Good morning. I'm with the Governor's Office for Children and Families. Just as a reminder of our program areas, we have prevention and family support, juvenile justice programming, family violence, as well as youth development. We are located on page 11, the tracking document. And I'll start with the reductions that are unique to us. Line 165.7. Oh, excuse me. Line 166.7. The reduction for community strategy grants. We have already received our continuation of applications for these, and one grantee didn't make the application deadline, so we did this out for us, so that's where our cut will come from. And then the increase in funds for the community-based grants, we have system of care grants that are in their second and third year, which this funding is for. Do y'all have any questions about that?
See, we had a question about 166.8, the increased funds.
Yes.
Could you talk about that line?
Yes, this was from last year. We were cut by $2.5 million and asked to use down our Children's Trust Fund Treasury account. We got special permission from OPB to be able to use those dollars in place of state dollars. This year, the governor has recommended that to replace the 2.5 with 1.86, and that cut will come from the new grants we will give out. Instead of giving out 8, we'll only give out 4.
What's the balance of the Children's Trust Fund?
July 1, it will be approximately $1.4 million.
Okay, is there any questions from the committee members? No questions? Thank you very much.
Thank you.
Department of Veteran Services.
Hi, how you doing?
Commissioner, we're delighted to have you here.
and I'm mighty glad to be here. Madam Chairman and members of the subcommittee, I'm Commissioner Pete Wheeler of the Georgia Department of Veterans Service. Our staff and I are pleased to be with you this morning to discuss the Governor's recommendation for fiscal year 2013 budget for our department. As you are aware from our presentation last month, our department is one of the 6 agencies established in Article 5 of the state constitution, and our responsibilities are found in Chapter 4, Title 38 of the state code. In federal fiscal year 2010, which is the most current year for data, there were over 773,000 veterans in Georgia. These veterans have served in every conflict from World War II to Afghanistan and Iraq. With the members of our military coming home from wartime service, many are returning to or settling in Georgia. Thus, the number of veterans residing in our state will be increasing in the coming months and years. The primary mission of our department is to assist Georgia veterans in filing and appealing claims with the U.S. Department of Veterans Affairs, the VA. Last year, those claims resulted in compensation and pensions for them amounting to over $1,730 million coming into our state's economy. We will be doing the same thing for the new returning veterans as they come into our communities over the next several years. I want to stress that no VA benefit is automatic. You must know about it and you must apply for it in order to receive it. Our 48 field offices around the state provide information and assistance to our veterans to help them to obtain the benefits to which they may be entitled. We support the Governor's recommended budget for fiscal year 2013. However, there are a few issues we want to discuss with you. With me today to present our comments on this budget is Mr. Dan Holtz, our Assistant Commissioner for Administration, Health, and Memorial. At this time, I'd like to turn the presentation over to Mr. Holtz. Dan?
Thank you, Commissioner Wheeler. Madam Chairman, it's good to be here again. There's a packet that we have provided, but it probably looks somewhat daunting, and I'm not going to go through all of it. So I'm just going to kind of quickly go through in the interest of time and highlight the things that are of concern to us. The tracking document pages are 30 through 33, in case you want to reference back to that. If you could turn to page 5 of the packet that we put out. This is a summary of the Governor's recommended budget for our department. Started out with the baseline of $20.5 million in round numbers, with the recommendations that are there to reduce that budget by a little over $107,000. It drops the budget down to $20,400,000. If you go over to pages 8 and 9 on the cemetery program, you'll recall when we talked with you about the amended 2012, we had a concern having to do with cash flow for the cemetery program. That same concern is with us on the 2013 budget also, except that the numbers are different. We've received a burial allowance from the VA that now amounts to $700 per burial, which projected out on a straight line for the fiscal year comes out to $142,304, and that's what is projected that we will be claiming based on historical burial information. The problem that we have with this is the way the VA actually pays us is not in a straight line. For example, we submitted payment claims in July and August of this past year that were not paid until December. And so we're concerned that doing a straight line projection of $142,000 could leave us short in terms of cash before the year is over, since it's a dollar-for-dollar offset that's being proposed here. So what we're asking the committee to do is, just like you did for us on the amended 2012 budget, is to reduce that number from 142,304 down to 94,500. We think that's a more realistic number based on the way the VA has been paying, and that we won't end up with a cash flow issue that we are afraid is going to happen. And I might point out the House budget that is coming your way did not correct that $142,000 issue, even though we asked for it to be done. And so you will have to take a look at that full amount, and hopefully you'll be able to do what you did for us in the 2012 amended. If you turn over to page 14 of the packet, I want to take just a few minutes to talk about some unfunded items that we'd like to bring to your attention. The first four of those were issues that we submitted to OPB. We had 8 positions that were authorized in the 2009 budget, and we were never able to fill them because of the budget reductions that kicked off in July of 2008 as when that fiscal year began. So we ultimately held those authorizations or those positions open until until January of last year, when Governor Deal directed that 14,000 positions that were open and unfilled be deleted, and our 8 positions were included in that. So we're asking that those be restored. They basically involve 6 field offices as well as 2 positions for our Claims and Appeals Division over at the VA Regional Office in Decatur. All of these positions are related to population increases of veterans that we are seeing already and anticipate are going to be coming with the increased population that we're seeing coming into the state. Columbus is probably the most notable with the bringing of the Armor Center down there, and there's going to be a lot of folks that will find Georgia to be a good place to reside and retire, and when they do, they'll become veterans and they will become our clients and our responsibility. And so we anticipate that we're going to have a significant need across the state, but Columbus being probably the highlight. The second one of these is to establish 6 field service officer positions in Cobb, Fulton, and Gwinnett counties. Presently, those counties have the largest population of veterans in the state, averaging over 53,000 per county, and we don't have a field service office in any of those 3 counties. Although I should clarify that and point out that we do have a small office over in the Twin Towers that covers the Atlanta area. But it's downtown, it's hard to get to for a lot of veterans who don't like to drive in the traffic. The VA is remodeling the old clinic at Fort McPherson and is going to be turning that into an outpatient clinic, and we've been in discussions with them about getting some space in that facility to put a couple of field service officers in there. They have a clinic already up in Austell and another one in Lawrenceville, and we're asking to be able to get space in those 2 facilities also. The problem that we're having now with the folks who reside, particularly in Cobb and Gwinnett, is that to get services from our department, they've got to go to Rome, Cartersville, Canton, Gainesville, Clarksville, Conyers, Griffin, Noonan, Carrollton, or Cedartown, and as opposed to being able to do it in their own county. So we'd like to see if we can't head down that road and get offices established there. The next one is 3 positions at our 2 cemeteries. We've learned over the last 10 years that the staffing model we started out with 5 people is basically 1 person short. When we have people who are on leave or are sick and we have a number of interments to deal with, that becomes a real problem. And so we would like to increase that minimum staffing pattern from 5 to 6. At Milledgeville, we've added and opened up the Phase 2 expansion to that facility, which is an additional 10 acres that we're having to take care of. And consequently, there's another position that we're asking for at the Milledgeville facility. Another position that we lost in that reduction that occurred last January was in our central office administration program, and we'd like to get that reestablished and put it against information technology. Right now we have one person that handles that for us, and he has statewide responsibilities as well as handling everything for us up here in Atlanta. And when he's out on a call, as he is today, that came in yesterday down at Noonan, and the computer went dead down there, and he's having to go down and fix it. When calls come in while he's gone, there's nobody to provide support. So we'd like to get a second person in there. The last item on that one is we did not submit to the governor, but it came up as a result of a piece of legislation that is pending before the Senate right now, which is the Returning Veterans Task Force, and that's Senate Bill 329. We would like to get, the way that law or that bill is structured is we would be the chair of that task force, which would include our department, behavioral health, community health, defense, labor, the university system, and the technical college system. And to do that right, we feel that we need to have 2 positions to be actively involved in that process and work with all of the agencies and make sure that that task force and its efforts are headed in the right direction and doing all the things that need to be done. And we ask for your consideration of that. That's all I would like to present. If you have any questions, I'd be more than happy to take those.
Yes, Senator.
Good morning.
In Southwest Georgia, Albany area, there have been some major concerns with the VA clinic, and we were wondering if there will be a change in administration or a change in provider services, and the transporting of veterans from the Southwest Georgia area to the VA hospital in Dublin. It's kind of a nightmare for a lot of them.
Mm-hmm.
They may have appointments that necessitate a certain time, and once they get there, the man may have to leave before the appointment time. They're seeing just kind of a logistical nightmare. So we've kind of gotten a lot of help from Senator Isaacson's office, Janice's office, and Senator Fisher's office. But we're still having concerns with the clinic. They moved from an area where veterans wasn't really accessible to them to sort of an off-the-beaten path place, difficult to find, difficult parking. It's not a very pleasant sight for these veterans, so we've been real concerned about that. Can you speak to those concerns?
Not directly, because that clinic is part of the U.S. Department of Veterans Affairs and not ours. But I can say this, that we've been working with those folks down there because we do have a field service office there. But the decisions that are made on that are out of our hands. But we will certainly do anything that we can from our level at the state to support getting the transport of patients from the Albany area up to Dublin, make sure that that's working like it should. I don't know exactly how that van is operating down there, if it's the DAV van or if it's a VA van, but we'll certainly keep our eye on the target and assist in any way that we can to make sure that the services are provided where needed.
And we've not heard or seen the service officers in Albany. We've not, and we've had meetings and they've not shown up, so we're not sure who we're talking to.
Okay. I don't know the specifics on that, but I will follow up on it, and we will make sure that whatever our people are doing down there, that they're involved in the process. Yes, ma'am.
Okay, Mr. Holtz, I can't see, sorry. Senator Holtz. Senator Holtz.
Thank you,
Senator Hill.
Thank you. I appreciate the desire to establish programs or individuals from your offices in Cobb and Fulton. I represent those areas. I'm just looking at the budget, and I strongly support what you're trying to do between Cobb and Fulton and Gwinnett. It makes a whole lot of sense. If we had to do only one as opposed to add Cobb and Gwinnett, from what I can tell, that's what you're recommending. Would it make any sense to do a site in North Fulton? Is there a place we could co-locate in North Fulton to, instead of having those positions in those three counties, if we had to make that choice of all or none?
Okay, what we have been trying to do with the VA is, since they are establishing these community clinics, we have been working with them to try and have our office co-located with their clinics. And so that's kind of been what we've been striving to do, and that's where the 3 comes up, because they are going to have a location at Fort Mac, and the Austell one is already open, and the Lawrenceville is already open. Now, what you're proposing would be that we would then set up a separate office in North Fulton, and the advantage of doing that, I certainly see where you're coming from in terms of pulling that together. The disadvantage is that what we are finding is most of the veterans who go to these clinics and come out of seeing a physician or a provider, in many cases, then have benefits questions and issues that they want to get answered. So having us co-located with those clinics is a real plus. So
That makes sense. Yeah. Just to follow up, that makes a lot of sense, plus the cost of adding, putting an office in North Fulton. The follow-up question is unrelated, but you referenced Senate Bill 329, the Returning Veterans Task Force. Is there I haven't read the bill, is there a time limit that the task force would be established? Is it only for a certain number of years, or are you asking for more of a permanent recommendation for 2 positions to fill that, should that task force be created?
if the way the bill is written, and we did not author the bill, it was authored by, I believe, Senator Harbison or someone on his behalf. And the way it's written, it's an open-ended task force, and so our request would be, as long as the task force is in existence, that we would need to have those positions.
And just, I like the idea if we could make it work in the budget, but I didn't know, sometimes we do these sunsets on task force.
There's no sunset on that bill as it stands today.
Thank you. Thank you, Senator Hill. Dan, it's been quite a while since we were down in Milledgeville, and I know Senator Grant keeps us abreast of what's going down there, but can you tell me the wings that you have open and what you have closed in the nursing home facility down there?
Yes,
Are they
ma'am.
the same ones that you had before?
Well, I think when you were down there, we had all the buildings open.
Yes.
Because of the budget reductions that have occurred, we presently, the Vinson building is not open.
Okay.
We had about 65 veteran patients in there. They have all either discharged,
Right, I remember that.
died, or we have moved them
Yes.
into the Wood or the Russell
Yes.
building. Presently, the Wood building, which is a 150-bed facility, is fully occupied by patients. We've got all 3 floors back open. We had a water problem due to some roof damage. That's all been fixed. So that building is fully occupied. We have reduced the census in the Russell building. I think we have 1 floor, if I remember right, that is presently not open. The other 2 floors are open. And then we have the Alzheimer's dementia unit in the Wheeler building. And we also have the second Alzheimer's unit that we have completed construction on. We're waiting on the furniture to be received, and as soon as that is, which we anticipate will happen late this month, the plan is to open that unit, and we're going to probably pull Alzheimer dementia patients from the general population that are not ambulatory and bring them into that new unit where they can receive direct attention. And it's probably going to be the folks that have the best or have the most need for intervention will be the ones that will be put into that new unit for the time being.
I think it'd be a good idea if we came back down and looked and see, because there has been a lot of changes. And
More than happy to have you there or in Augusta, either one at any time. Just you know.
We've never been to Augusta. I've never been to Augusta, but I specifically would like to see Milledgeville again and see the Alzheimer's and what's going on. So maybe we can do that in the spring, and we can work with Commissioner Shelp and see what he's got going on, and do y'all in the morning and do Commissioner Shelp.
Not a
in the
problem. We'd be
afternoon.
happy to have you anytime.
Okay, sounds good. Any other questions for Mr. Holtz? Okay, thank you very much.
Thank you very much.
And I believe you gave those cost estimates to Clay.
Yes, he has them.
Yes, thank you. Okay, with that, we'll have Commissioner Shelp. Commissioner Wheeler, stay well. Stay well. Safe journey. We will. Senator Grant, maybe you can line that up for us. Get us down there this spring. Let us recuperate from the session. We definitely need that. Yeah. Okay. Commissioner, do you have a handout, or you gonna put it up?
We are going to put it up on the screen. I don't know how easily you can see it. We're going to work from your tracking document.
Okay. Sure. Have you got the screen? Can you turn this? This one says.
I got something here. All right.
Welcome.
Thank you.
Glad to have you this morning.
Thank you, Senator. We will work off the Senate tracking document, and the first page will begin with the total budget. And before we start, I wanted to make just a few summary statements that I think will be helpful in going through the document more efficiently. And that is to say that in every program budget, we have 12 program budgets, and in every program budget, there are going to be recurring themes that I'll speak to once now, and then will not speak to after that. And these include the transfer of funds that are part of the state health benefit plan. It includes a reflection of the employee, a correction to the employee's retirement system, as well as an adjustment to telecommunications expenses and to workers' compensation premiums. And these are all four adjustments that occur throughout the budget and are really done outside of DBHDD directly as part of a statewide kind of process. So I won't make anything more of that as we go through those program budgets. The other summary statement I think would be helpful is that you will see, this affects 5 programs, you will see transfers from direct care and support to 4 different program budgets. Direct care and support is largely a program budget that is personnel, and the transfers will go from direct care and support to adult mental health, developmental disabilities hospital, forensic hospital, and the nursing home. So this is a move of the matched funding to personnel out of direct care and support into the 4 programs that are all facility-based, hospital-based programs. The people don't move, nothing materially changes, but this allows us to assign the costs of those facilities, of those personnel to those facilities, more specific to the programs in which they actually work. And so this will allow for an accounting that is more accurate in looking at those facilities. So adult mental health, forensics, developmental disabilities, and the nursing home will all show additions that are revenue neutral, that are coming out of direct care and support. And then when we get to direct care and support, you will see the sum minus. And that transfer, I'll just point out as we go, but I think it's helpful to know that up front. So starting with our first page, you see the total budget at about $1.15 billion, and this includes both federal funding and direct state appropriations. The final budget occurs with a slight variance of about $807,000 that is due to some small increases that come from all right, that will reflect the total. Okay, so what you see is the starting budget of $1.115 billion, and then we will show you how we arrive at a final budget of $1.1528 billion as we walk through each of the programs individually. So the first program we'll consider is Adult Addictive Disease Services. And of note, this is largely federal money with a very small, relatively small portion from state match. If we move down, you see the 4 areas that I spoke about earlier, and then 5.2.5 is the first item of real significance, and it shows an $8.5 million loss, which is due to changes in the block grant for the TANF supplemental funding coming from Washington. Now, our total in that program from the TANF program, which is largely about women and children, it's exclusively about women and children, is about $20.1 million historically. And we have about $11.5 million that remains in this kind of program, but we do anticipate a direct loss to specific services. Of these TANF programs, some is for the elimination of transitional housing slots, some reductions in a START pilot program, training funds, and independent living support. And there is a 25% reduction in TANF substance abuse residential slots. This is of greatest concern because half of these women in these residential treatment slots were involved with law enforcement or criminal justice somewhere in the preceding 12 months prior to joining the program. and they all have children, and on average about 2. So the potential loss there is significant. We have worked diligently to backfill most of that by redirecting some other federal funding that was more flexible and some reductions in some other programs. But after all is said and done, we're still looking at somewhere around $8 million loss, and we'll be continuing to try to find funding for that.
What was the total amount that you redirected?
About $2.5 million is being redirected out of other areas. So this leaves us with an end budget for addictive diseases of $86.5 million, which is down from the $94.4 million initially. The next program budget is adult developmental disabilities. Again, in 53.1 through .4, you see those 4 areas I addressed earlier. In point 53.5, you see the first influx of money from direct care and support being transferred to adult developmental disabilities in our hospitals, the ICFMR portion of our hospitals. This is largely therapists, occupational therapists, activity therapists, physical therapists, and other clinical support from direct care and support moving in, which is that $2.8 million figure. There in 53.6, there is a slight increase in funds to reflect a change in federal participation rate, kind of the FMAP adjustments of about $1 million. And then a reduction in funds that was part of our 2% reduction that we were asked to make. We did this earlier in the amended budget and again here in 013 fiscal budget of about $750,000 that was taken out of service contracts primarily, not direct care contracts. In 53.8, we have an increase in waiver funding. This is to correspond to our commitments under our ADA settlement agreement with the Department of Justice. That's correct. This 4.2 is related to the ADA settlement, but it's not waiver funding. This is excluding waivers. This is funding for support in crisis, the crisis respite homes, our mobile crisis teams, family supports, and ongoing education with law enforcement, the judicial department, and monitoring of these services. These crisis supports, I would again say, have been successful in allowing us to no longer admit people with intellectual disabilities to our hospitals. We've had over 1,500 direct responses and have had the majority of those able to be maintained in their residence at the time without any physical transition being made, but by being able to do technical assistance on site. So this has been a very successful part of the program. In 53.9, this is where we see our waiver funding. And it is about $6.1 million, and this again is for 150 comp waivers for the, and 150 new now waivers for the ADA settlement and for our ongoing effort to provide community-based care for those with intellectual disabilities. 53.10, this is a reduction of $1.5 million, which is due to a truing up of money in the Money Follows the Person program. Under the Medicaid match, when someone comes out of a facility, the first year, the first 12 months of their waiver funding is enhanced by about 18%. And this allows for extra expenses associated with startup costs of either modifications to a home or other kinds of special devices. That money starts when the person comes out of the facility, and so it almost always overlaps a fiscal year. And so in the fiscal year and the annualization process of the waiver funding, there is a flowing over of that money follows the person 18% supplement. That supplement is not necessarily used in that time period, and so over time there's a bit of an accrual, and this is a truing up of that, a giving back of about $1.5 million around that money follows the person. In 53.11, this is a small reduction which is related to that TANF supplemental grant reduction from the feds, from CMS, and this is a relatively small portion that has been traditionally used in developmental disabilities, but it's still the TANF funding loss. In 53.12 and 53.13, you're seeing a net zero, but what is happening in the actual bookkeeping is a reduction in state funds matched by a slight increase in federal funds that is associated with the BIP program. The BIP program is a balancing incentive payment program by CMS, and it is predicated on application by DCH for a couple of different functions that Medicaid is trying to encourage, and as a response they're giving an extra couple of percent on the Medicaid associated funding. And these requirements are basically for some independent case management of the individuals and their funding, and for some IT technical infrastructure to coordinate across accounting and some things like that. And I understand that DCH is poised to submit that BIP application. To date, only one state has submitted and been approved, and that's New Hampshire. Maryland is believed to be approved very shortly, and Georgia is lined up to be the third state to qualify for this BIP funding. And so this BIP money you will see in some other programs as we go forward. But that leaves us with a total for adult developmental disabilities of $343,500,000, which is a small net increase over the $328,682,000 where we started. The next program is Adult Forensic Services. In 54.1 through 4, you see those 4 items I mentioned at the beginning. In 54.4, you see a transfer from direct care and support into the forensic program that I spoke about, same kinds of clinical staff. In 54.5, you see $5.6 million, which is to expand the forensic units in Savannah to allow us to basically eliminate the waiting list in the jails, which we have now down to about 60. Many are receiving restoration services in the jails, and I think we've maximized those efforts. These 40 beds will allow us to fully meet those forensic demands. In 54.6, we see a small increase for 3 additional forensic psychologists and their related expenses in travel. These are critical to being able to maintain this waiting list time or turnaround in the jails. We'll have these evaluators able to go and deliver these services on location throughout the state, and will help us to make sure that individuals are not delayed in jail because of competency evaluation needs or restoration services. And that leaves us with a final adult forensic services budget of $68.4 million. from a starting, right, 55.7. And, right, that leaves us with a $68.4 million over the beginning of 55.7. The next program budget is Adult Mental Health Services. And again, we start with 55.1 through 4, those items I mentioned. 55.5 is that transfer from direct care and support into adult mental health. And then an FMAP correction in 55.6. And then in 55.7, we see a reduction, part of our 2% reduction of about $3 million, which came from contracts spread across all providers. 55.8 is replacing state funds with Medicaid administrative funds for contractual services. These next two items, 55.8 and 55.9, both show a net zero, but they represent a reduction in direct state appropriations matched by increased federal funding, and this has been achieved by moving more tasks, more services that can be matched by Medicaid dollars into Medicaid compliant programming. And so we've been able to maximize some of our federal money, but on the tracking document it shows a net zero. In 55.10, we see an increase of $20.3 million, and this goes to the ADA settlement items that we've talked about before. I can certainly show that graph again that we saw during the amended budget. If you would like, it's your preference, Madam Chair. Would you want to continue through the budget document, or did you want to see these items?
The budget document.
Okay. I'll just mention briefly then, these are ACT teams, assertive community treatment, community support treatment, intensive case management, supportive employment, housing, crisis stabilization unit funding, mobile crisis, and other activities that are all associated with complying with our ADA settlement. In 55.11 and 55.11, you see a yes, you see an item with a yes and no funding. And this means that the Office of Planning and Budget and the Governor's Office support this program and would like to see it come to fruition, but cannot find the dollars to do that today. The estimated cost, what this is a emergency psychiatric services center targeted for metropolitan or for urban city of Atlanta that would allow for immediate assessment and treatment of individuals in emergency settings, and would take pressure off emergency rooms throughout the city and allow us to treat individuals and do some rapid follow-up. The cost for this is estimated somewhere around $11.6 million. We've looked at modifications to this program, and we've talked with folks at Grady and have been looking for other funds to possibly move forward, at least with an initiation of this project. That leaves, and then in 55.12, I'll just mention it's a net zero on the tracking document, but it represents a decrease in state appropriation dollars and an increase in federal money associated with being part of the BIP program, the Balancing Incentive Payment Program.
Excuse me, Dr. Shelp, do you have a contract with Grady yet on that?
No, we're not in a contract. We're far from that at this point. We're in active discussions with folks there.
Okay.
That leaves us with a final of $306 million from a starting point of $282 million in adult mental health. The next program budget is the adult nursing home, and You have the 4 items that I mentioned, plus a transfer from direct care and support, again, for occupational therapists, physical therapists, and others, to about $1.1 million. After those corrections, this leaves us with a final budget for the nursing home of $11.2 million from a starting point of 9.8. And in child and adolescent addictive disease services, again, this is largely a federal grant-funded program. You see our first initial adjustments, and that is really the only adjustments being made to this program. So there are some slight net increases due to retirement fund and other corrections. The next program budget is child and adolescent developmental disabilities. This budget similarly has no real change except for those corrections around state benefits and employee retirement, telecommunications, and so the final budget is 10.96, up from 10.86 million dollars. The next program budget is child and adolescent forensic services. This is a small but important program. Again, it has no budgetary changes other than the corrections around benefits and employee retirement and telecommunications. So the final budget is $3.3 million, up from 2.2 from the starting point. The next program budget is child and adolescent mental health services. You have the 4 items in 60.1 through 60.4, and then you have in 60.5 part of our 2% reduction, which came from contracts really across all providers. And in 60.6, you see a net zero, but again, this is the BIP program. Behind that zero is a small decrease in state funds and a corresponding increase in federal funding. And so the final budget represents $86.2 million from a starting point of 88.1. All right, I should say in 60.5, just to be clear, that as part of the 2% reduction, the child and adolescent services had showed an accrual of some monies as a result of our efforts to move all children and adolescents into Medicaid status so that we could get federal matching dollars. So the actual state dollars have been transferred to adult mental health, which I could have mentioned earlier, and that's what that slight drop is, which is why we end up with 86 million at the bottom. There's no actual change in services. It was not a reduction to contracts with providers. It was actually a transfer that was related to our ability to move those children who were not currently in Medicaid into Medicaid and draw down that federal match, which made this program more efficient and allowed us to redirect those funds to the adult side. But there was no loss in service. I don't want to be misleading there. The next program budget is the department's administrative budget. And you see the adjustments in 61.1 through 61.4, and 0.5 is an unemployment adjustment, a reduction in our premiums, a slight increase in our general liability, PeopleSoft billing, and a reduction in the funds that were charged from SPA for their services. And so the difference after those corrections is approximately $49.5 million from a starting point of about 48 million. The direct care and support is the next program budget, and this is where you see in 62.4, you see that $11.2 million, and that is the funding being transferred out of direct care and support into those other 4 program budgets that we've already looked at. So that is the movement of occupational activity and physical therapists into the programs in which they actually work and serve. Then there is in 62.5, and again a net zero. This was savings that we accrued from the closing of the hospital, which OPB has allowed us to redirect to cover some of our unemployment costs. And then in 62.6, we have another truing up of unemployment insurance expenses. These are listed as 2 separate items, but they're really about the same. And then our final budget is 156.2 million from a starting point of about 163 after the movement of those therapists to their associated programs. Then our next program is the substance abuse prevention program. This is largely federally funded, a very small state contribution, about a little less than $200,000. You see the truing up of those different supportive expenses, and a final budget of 13.4 over a starting budget of 13.4. I mean, a very small increase after truing up those other expenses. And then we have attached agencies. The Governor's Council on Developmental Disabilities. This is almost exclusively federally funded, and a net change of about $1,000 due to their contribution to the 2% reduction. And the Sex Offender Review Board is about $750,000 with no real change in that budget. And that is the 013 budget from the governor.
Sarah Carter.
Thank you, Madam Chair. I've got a number of questions. Let's go back to 54.6. The increased funds for contract forensic evaluators to perform evaluations statewide. Mm-hmm. You said that was 3 positions?
It's 3 positions plus their associated expenses, which are largely transportation, because they would basically be serving county jails all across Georgia.
Do you have a breakout? I mean, can you give me an idea? What are we talking about in salary, and then what are we talking about in transportation cost?
In salary for psychologists right now, our range is somewhere around 70, between 70 to 90,000 per person in salary, and then benefits, and then transportation. So the 3 salaries would come to somewhere shy of 300,000, maybe 280,000, plus 40% for benefits, and then their associated costs. So if you add the 40% for benefits, at 90 you're at about 130, so that's about 390, and then about 60,000 in other expenses.
Okay, above that, I believe it was in 54.5, you mentioned increased funds to provide for an additional 40-bed unit to decrease waiting lists. Did you say that was in Chatham County?
The hospital is in Chatham County. The waiting list is in all jails across the state.
And the hospital is at?
It's the Georgia Regional Hospital, Savannah.
Okay. May I? Mm-hmm. And then on, can you, on 55.12, can you just explain to me, maybe I'm the only one who doesn't understand BIP? What
Okay.
exactly is that?
BIP is a federal initiative through CMS, through the Center for Medicaid and Medicare Services, where they are providing an enhanced federal match for Medicaid services to states who participate in this BIP program. And BIP is, the acronym stands for Balancing Incentive Payment. And can you put that up? Or you don't have it? Okay. And I do have a handout, actually, I could give you on the BIP program, but basically, the states submit an application and they commit to doing a few things, which are some information management items, some technical communication kinds of programs. Most significantly, they commit to an independent case management program where you have someone who has no vested interest in providing the services, who does the evaluations for the individuals in those services. And so in doing that, by making this BIP application and agreeing to do these different activities, the state becomes eligible for that increased federal match. And specifically, it says that the states must collect information on utilization, quality measures, the beneficiary outcomes, and cannot adopt more restrictive eligibility standards than were in place at the end of calendar year 2010. They're required that the changes there's a hope on the part of the feds that these measures, these quality measures and utilization, information collection and everything else may accrue to some financial benefit, some efficiency. This is the aspiration on the CMS side. And so to participate in that, they're allowing for this extra enhanced match, about 1.5 to 2%.
It seems somewhat strange for the federal government to be incentivizing something that they could require us to do in order to get the funds in the first place. Anyway, that's
Yeah, I don't often understand
okay.
the motivations inside the Beltway.
Okay. I've got two more, if that's okay. On the substance abuse prevention program on page 9 at the bottom, we're talking about the purpose of this appropriation is to promote the health and well-being of children, youth, families, and communities through preventing the use and/or abuse of alcohol, tobacco, and drugs. And I know you said that was primarily a pass-through, that most of that is federal dollars, but we're administering the program. What are we doing?
Let's see, child, what document? My pages aren't numbered. Do you have?
It's on page 9 at the bottom.
Okay, I think I have it here. Most of this are prevention programs that take place at the level of schools and clubhouses. The prevention providers will provide training, support, and some intervention at for children and adolescents as either part of school or after school kinds of programs. What else would I say about this? You may have heard of the Red Ribbon program or Red Ribbon campaign, and there's a Red Ribbon Day. We have that here at the Capitol, and awards are given for the programs that are voted most effective and most imaginative and most engaging. And so those are the kinds of programs that are in this this area.
And one last question.
Sure.
on page 10, the Sexual Offender Review Board, does the governor make those appointments to that review board?
Does what now?
Does the governor make those appointments to that review board, or who makes up that review board? Who?
I would imagine that it is the governor. I can't say with certainty. It is an attached agency, and so the department provides for them shared pass-through services like paying employees, insurance benefits, telephones, office space, but we don't actually manage the program or give direction to the individuals that are in the program. But we provide for them those ancillary services that would be overly costly to stand up for the small group.
Okay. How many people are on the board? And I mean, so you're just a financial pass-through to it?
We are, for the most part, yes, we're a financial pass-through. We do all those kinds of supportive things that just allow the people to come and go from work and have a place and a phone and get their insurance and their paychecks and whatnot. But we're not really part of their programming or their management of their programming. And their board, I would only be speculating with you as to how many are on that board and who appoints them. I could certainly
Do you
look into
mind
that.
finding out? Can y'all
Sure.
get that to us? I'd appreciate
Sure.
it. Thank you.
Actually, is that-
Thank you, Commissioner.
Mhm.
If there's any other questions? No other questions?
No question. Thank you.
Next, we have Commissioner Reese. You'll come forward.
Sure.
All right, thank you. All right, thank you, Madam Chair, members of the committee. Appreciate the opportunity to be here to present the governor's recommendation for the Department of Human Services for fiscal year 2013. I'm going to concentrate mainly as I go through on state funds. I'm using your tracking document. I apologize, we don't have anything to put up on the screen, but I'm using the Senate tracking document. As Dr. Shelp said, I'll go through the statewide adjustments for the first program, and then I will not reiterate those. They're common and germane to each program. So I'll start out with, this is Section 27, Department of Human Services, and I'll start out with adoption services. This is 174.1. We start with a continuation budget figure of a little over $34 million. We have around $55 million in federal funds for this program, and these are the one time that I'll go through these statewide adjustments. We have an increase in funds to reflect the increase in the employer share for the state health benefit plan. We have an increase in funds to reflect an adjustment in the employer share of the employee's retirement system. We have a reduction to reflect an adjustment in workers' compensation premiums. We have an increase to reflect an adjustment in unemployment insurance. We have an increase for general insurance risk liability premiums. We have a reduction to reflect a state personnel administration assessment going from $137 per position to $73. And we have a replacement of funds to reflect the change in the FMAP rate here, going from 65.95% to 65.71. So with that, we end up with a recommendation for 13 of a little over $34,257,000. Next, we go to after-school care. This is a program that is 0 state dollars and 100% federal dollars. The federal continuation is $15,650, and we have that same recommended figure for 13 for after-school care. Next, you have on your tracking document business enterprise programs. So I want to take this opportunity to talk about what these are. This is 176.100. As you know, earlier in the session, the governor recommended to move the vocational rehabilitation services and all of its programs, of which there are primarily 5, from the Department of Labor to the Department of Human Services. So in our budget and in our recommendations, you'll see the budget figures for those voc rehab programs. That proposal has since been amended to make the voc rehab programs an attached agency to DHS. As you know, depending on what the attached agency is, the agency to which they are attached can perform different functions for them, whether it be as little as just running their budget through the big budget. It can be providing staff, it can be providing administrative support, et cetera. We are in the process of determining just what it is we will provide and the assistance and support we will provide to the voc rehabilitation agency when it is and becomes attached to DHS. So unless you want me to, I will not go through the figures for each of their programs, but that's why they're in our budget now, but that proposal has been amended. So I'll go down to child care licensing. This program is 0 state dollars. We have a total of a little over $2 million in federal funds. We have an increase here of an injection of state funds to maximize Title IV-E participation of a little over $1 million. And so for state fund recommendation for 13 for child care licensing, we end up with a recommendation of state dollars of a little over $1 million. Next, we move to child care services. This is 178.98, and what you'll see here is a continuation budget of $54.2 million and then a recommendation for 13 of 0. And the reason is that the governor has proposed to move the child care subsidy dollars from the Department of Human Services to the Department of Early Care and Learning beginning on July 1 or fiscal year 13. If you recall, the state applied for a Race to the Top Early Learning Challenge grant late last year, and the rationale for including in that proposal that application to Washington to move the child care subsidy dollars from DHS to DECAL was that it made sense to consolidate services for children 0 to 5 in one state agency. So even though the state was not successful in receiving that grant, this proposal continues, and it is our recommendation to move these dollars to DECAL. Now, the eligibility determinations for who gets the child care subsidy dollars to help them with daycare expenses or after-school expenses, that will remain with the Department of Human Services and be conducted in our offices around the state, but the administration of the program and the dollars here, which include 54.2 state and around 168 federal, will go to early care and learning. Next, we move to child support services. This is 179.100. We started out here with a continuation base of 25.1 million. We have our statewide adjustments that I'd talked about earlier. And here we have an actual state dollar cut on 179.8 of $1.5 million, and child support will use incentive funds that they have earned through their performance over the years to replace these state dollars to continue with their services. And so we end up with a recommendation for 13 of $24.6 million. Next, we go to child welfare services. These are the frontline workers who investigate and work with child abuse and neglect. We start out with a continuation budget of $89.7 million. We have the statewide adjustments that we've been through, and we are recommending no cuts in this program, and we end up with a recommendation for 13 of $91.4 million. This is, as I said, I'm concentrating on state dollars here. Next, we go to community services. This is a 100% federally funded program. The federal funds are a little over $17 million, 0 state funds, and so our recommendation for community services for 13 is $17,189,000. Next, we go to departmental administration. We have a continuation figure here of $34.6 million. We have federal funds of $49.5 with almost $100 million total public funds. I should point out, as I did last year, that departmental administration includes many items such as budgeting, accounting, financial services, strategic planning, travel, fraud investigations, EBT card processing, success mailing, the food stamp notice mailings, and also legal support. So we have here recommendations for the statewide adjustments. Then we actually have a state dollar reduction of $668,000. We have an enhancement to reflect the increase in volume for EBT processing of $2.7 million, and that is on 182.10. And so we also have a reference here to the administration and the administrative funds for the vocational rehabilitation services, because as I said, that has been amended. So it's to be determined how their budget is going to work with ours, whether we will do that for them as we do with some attached agencies or whether they'll do it themselves. There'll be a fairly large attached agency. So I think you can disregard that at this time, and we end up here with a recommendation of 38.9 for 13 for DHS departmental administration. Next, you'll see a reference to disability adjudication section. These are the around 560 people in Stone Mountain who do eligibility determinations for Social Security through contract with the Department of Labor, and that will be a part of the vocational rehab agency. We go down to elder abuse investigations and prevention. Here we have a continuation figure of $12.287 million. We have our statewide adjustments. One thing I'll point out here is on 184.8, you have an injection of state funds of $1.6 million. This is to replace the loss of civil monetary penalty funds that as of January 1, 2012, the state is no longer able to use for adult protective services and for long-term care ombudsman. It was about $1 million for adult protective services and about $611,000 for long-term care ombudsman. The federal interpretation now is that these civil monetary penalties, which are penalties levied on long-term care facilities, primarily nursing facilities, for violations of care that they may have incurred, can only be used to further and for the residents of those facilities, and not necessarily in the manner of which we've used them before in these circumstances. So we've had an injection of state funds to account for that, leading to a recommendation on line 184.1 of $14.2 million for 13. We move next to elder community living services. We start here with a continuation budget of $71.4. This includes a little over $5 million in tobacco settlement funds. We have our statewide adjustments. We end up with a recommendation of $71.8 million, with that a little over $5 million in tobacco settlement funds included. We go to elder support services. Here we start with a continuation figure of 2.847 million. We have our statewide adjustments. We're recommending no cuts, so we come out with a recommendation for 13 of 2.854 million. We move over to energy assistance, 187.1. This is a 100% federally funded program to provide low-income households with assistance to meet their home energy needs. We have a $24.2 million figure of federal funds, and that is our recommendation for 13. And again, these are 0 state dollars for this program. Next, we move to family violence services. This is 188.100. These are funds that are used to provide safe shelter and services for victims of domestic violence and sexual assault. We help fund around, I believe it's around 46 domestic violence centers and about 25 sexual assault centers throughout the state for the past 2 years, and we will continue to do this for fiscal year 13. We will contract with the Governor's Office of Children and Families to have this money appropriated to the DHS budget, but then transfer it to them by agreement, and they will administer the funds. We have here a continuation figure of 1.655 million. We have federal funds of 12.1 million. We have an injection of state funds to replace TANF dollars of 9.8 million on line 188.1. And we end up here with a continuation figure of state dollars of 11.5 million. If you'll recall, last year there was some concern as to whether TANF dollars could be used for these purposes. And so we tried to adjust it last year and then this year also with an injection of state dollars to eliminate any concern or any uncertainty with regard to that. Next, we move to federal eligibility benefit services. This is 189.100. These are our frontline workers in all the DFACS offices in 159 counties throughout the state who help determine eligibility for food stamps, for Medicaid, for TANF, and also for the child care subsidy that I mentioned. We start out with a state continuation figure of 99.9 million. We have our statewide adjustments. We're recommending no cuts in this area. We've had a tremendous increase in the volume of food stamp activity, with also primarily food stamp activity, somewhat Medicaid. TANF has decreased over the years, but the primary stressor in this program is the food stamp volume. And we've also had over the past few years with the state budget cuts a reduction in staff to accommodate. So I think if you recall from my presentation to the Joint Committee, our caseload per worker for this program is about 757 cases per worker. So we're recommending no cuts in this area with a recommendation for 13 of 104.4 million. Next, we go to federal fund transfers to other agencies. These are federal dollars that are appropriated to the Department of Human Services, but are then passed through DHS out to other state agencies. One thing I mentioned here that I went over in some detail in the joint presentation is the loss of $37 million in TANF supplemental funds. There were 17 states over the years that had received a supplemental TANF appropriation from the federal government for various reasons for a number of years. And in the federal budget deliberations, we have been pretty much assured that this supplemental grant will be going away for Georgia and these other states. It is not final to my knowledge yet with actually signed federal budget, but we were told not to anticipate receiving these funds, so we had to spread out the impact of this through all of our programs. I think this particular program is the one where you'll see the biggest impact. You've probably heard Dr. Schelt talk about the loss of TANF supplemental dollars for his agency. Here we have around, as in our calculations, around 8.9 million reduction in transfers to DBHDD and around 6.3 million reduction to public health. And so these are hard cuts to make, but we had to try to find a way to spread that $37 million reduction over, and I think this is the program where you see the most impact. So we end up here with a federal dollar recommendation for 13 of $89.5 million. Next, we go to federal unobligated balances. This is a zero state dollar program. There's no services provided here. Essentially, this is TANF carryover money from one year to the next is estimated by OPB. So we have here $8.7 million figure for 13. The next program indicated is Georgia Industries for the Blind. This is also a vocational rehabilitation program, and this will be a part of the attached agency, but the budget figures were originally included in the DHS budget. The next program is out-of-home care. This is 193.100. We start here with a continuation figure of 59.5 million. We have our statewide adjustments, and then we have here an increase in funds for out-of-home care utilization. There had been in previous years a reduction in the use of these services, but we've seen beginning with fiscal year 12 a slight increase in the utilization of out-of-home care for various reasons. One of them may be my emphasis on safety when I came into the department, talking about our child welfare practice model. So we've seen some increase. We think over time as that model is implemented that there'll be some equilibrium and balancing out of this utilization, but we were appropriated or recommended to include about $3.8 million increase to accommodate this increased utilization. You'll see a replacement on 193.3 of state dollars for TANF, and then we end up here with a recommendation of a little over 68 million for 13 for out-of-home care. Next, we go to refugee assistance. This is a 100% federally funded program. The federal dollars are $8.7 million, and that is our recommendation for fiscal year 13. You've probably heard me say that the governor has asked the department to do an evaluation of the refugee program and how that is administered and handled in the state, and that is ongoing. But this is our recommendation for fiscal year 13 with regard to those federal funds. Next, you'll see a reference to Roosevelt Warm Springs Institute. These are the healthcare facilities in Warm Springs, Georgia, which includes a long-term acute care facility and an inpatient rehabilitation facility, along with other assorted services on that campus there. That is a part of the vocational rehab services, and it will be a part of the new attached agency. We go down to 196.1, support for needy families, basic assistance. These are funds, cash assistance funds to help promote self-sufficiency for low-income Georgians. This is a primarily federally funded program. We only have $100,000 in state dollars in this program, and that is primarily to support 35, that's the last figure that I was given, two-parent families who are a part of this program. We go next to support for needy families work assistance. These are funds to help TANF recipients maintain their employment. So this may be help with transportation, this may be help with child care in certain circumstances. This is a zero state dollar program, $21.7 million federal, and that is our recommendation for 13. Next, you'll see a reference to vocational rehabilitation program, and that is the primary component of the voc rehab services now provided by the Department of Labor. This would have been around 780 positions and their state and federal funds to come with it, but this will now be a part of the new attached agency. Finally, I'll reference our two current attached agencies. We have the Council on Aging, and they had a continuation budget of a little over $198,000. They have their statewide adjustments for SHBP and for the retirement system. And then they had two small cuts, well, not small to them, but relatively small, for contractual services and operations, which amount to about almost $4,000, and I know that they came before you with regard to 12 amended to ask for restoration of those, and I'm sure they would want me, if they haven't already themselves, to support restoration of that for 13 as well. What I've been told is that those funds are used primarily to help reimburse their council members on meeting travel per diem reimbursement. So I'll make that comment for them. Finally, we have the Family Connection Program. These are the county collaborative programs throughout the state. We have a continuation budget of $7.9 million. You have a recommended cut in contractuals of around $19,000, and then a cut in their county collaborative contracts, which on line 200.2 comes to a little over $139,000. In my understanding, that comes out to about $880 per county collaborative contract. They have a replacement of some state dollars to replace TANF dollars, with an ultimate recommendation for fiscal year 13 of 9.32225. And so that, Madam Chair, concludes the presentation of the programs for DHS for fiscal year 13, and I'd be happy to answer any questions that you or the committee may have. Yes.
So if they're not involved in eviction programs, doesn't it impact on the roof budget?
Well, it could have a ripple effect, and as I said, these are the cuts that you don't want to make, and you try to find somewhere to come up with that $37 million, and in those programs that we support, both public health and DBHDD, that's primarily where the biggest hit was taken. So I think there's no question, you're right, there may be some ripple effect, and if there was some way to accommodate that, we'd certainly be willing to support discussions about that.
I know that if you're not taking care of those kids with the mother, someone's going to take care of them, and it's much more expensive.
That's right. I think you're rather right.
Social conscience of it.
Thank you, Madam Chair. On 179.8, that's on page 16, you talk about incentive funds that had been earned in the past. Were they earned from federal programs? Are they federal dollars?
Yes, sir. You're talking about child support?
Yes.
Yeah, there are 5 criteria that are used to determine whether a state can qualify for incentive funds from the federal child support agency. And those are establishment of paternity, establishment of support orders, collection of current support, collection of arrears, that money that's past due, and overall cost effectiveness of your program. And the federal government puts that money into a pool, and that pool can be drawn from by the 50 states depending on their performance. Georgia has performed well in the previous 4 to 5 years and has earned incentive funds that we can utilize to make up for that state dollar cut.
On page 20, on 184.8, this is increased funds to replace loss of civil monetary penalty funds. You said that was the penalties that are levied on nursing homes?
It's primarily nursing homes and long-term care facilities for violations of rules and regulations with regard to the care of residents. And in the past, we have used some of those civil monetary penalties to support adult protective services and to support the long-term care ombudsman. But as of January 1 of 2012, the federal government has reinterpreted its regulations and said that those monetary penalties can only be used directly for the care of residents in long-term care facilities, which sort of takes it out of the purview of those particular programs, though it's still money to be used to support the elderly and the aging. So this is an injection of state dollars to accommodate the loss of the ability to use that money for the purpose for which we had been using it.
So you're putting money in here to replace that.
Yes, sir.
And that money that you're putting in there will continue to fund the ombudsman and...
Yes, sir.
Okay, so the money that's going to be distributed to the nurse, the civil penalties that are levied on the nursing homes or on long-term care facilities, how is it going to be distributed back to the nursing homes?
No, it wouldn't go. It comes from them.
It comes from them.
Right.
Where does it go?
That I don't know. I think that might actually be done by community health because they regulate nursing homes through Medicaid, and I think they primarily are the ones that would be involved in that. But we can find out exactly where the money that's redirected and now we're using state dollars from, how is it going to be used? I can find out.
Commissioner, could you give me in this report an analysis of the trends on the SNAP program?
Yes. Yes, ma'am, we will.
Like the last 5 years?
Okay.
Just see where we are.
Right. Okay. A tremendous increase in that. I think the figure I'd seen was something like 470% increase in the last 5 years, but we'll get you the numbers. Okay. All right. Thank you. Already put your pitch in for you. That's right.
I think Commissioner Reese already did my presentation and did it well. I do want to recognize that Ann Williams, one of our council members, is with us today and asked me if I would come up and speak with you briefly. Thank you so much for the restoration of this 2% cut in fiscal year amended recommendations. And we are looking at page 29 of your tracking document. 199.100, which is Council on Aging. The council is fully state funded. There are no federal dollars allocated for its function. And as you know, it was established by the Georgia General Assembly in 1977. The 20 council members are appointed by the governor, lieutenant governor, speaker of the House, and Commissioner Reese. Our total funding is $198,052. Over the past 4 years, the council has lost almost 27% of its funding, which is the reason why we're here speaking to you about 199.3 and 199.4. Small amounts of funding lost, but that funding is used for the purpose of reimbursing those 20 council members for their direct expenses that they incur when they are attending the 4 meetings a year, when they're going about their appointed duties. They are reimbursed according to state policy, so it's just for money spent for their meals, travel, and lodging. The other support is provided by the department in the way of 2 staff people and printing and so forth. There was a question at the last hearing that I did want to clarify just a bit. It came from Senator Grant about whether the council does raise funding, and we are pretty active in charging fees and getting sponsorships and so forth for a variety of our activities like outreach and advocacy, education, and our special projects like Georgia for a Lifetime. So those are projects where we do raise a good bit of funding and utilize that through a state-approved trust fund. Do you have any questions?
No questions.
Very simple. Thank you very much.
Okay, Clay, I think that concludes our hearing today, and we'll get to work next week. I appreciate everyone coming today, and this concludes this meeting. Thank you very much.